So you may have heard the new study that came out on from the CDC on natural immunity in comparison to vaccine immunity during the Delta wave. Been some very interesting conclusions from that I want to talk about. We're going to break down some of that data. Also wanted to sort of take some other data and put into context what this means, not only for policy and what policies governments really should go for if they're following the science, but also just kind of break down a bit of an understanding of why we can't just say all unvaccinated people are the same or all vaccinated people are the same. These blanket statements that keep happening throughout the course of COVID that are creating a public that is just completely misled about the risk of COVID and what's actually going on there, which ultimately is going to have them supporting, as voters, ideas that are actually bad and that are unscientific. So we're gonna talk about that a little bit, break it down, and just really put into context, for practicality's sake, what this kind of stuff means. So obviously this study comes out of the CDC, COVID-19 cases and hospitalizations by COVID-19 vaccination status and previous COVID-19 diagnosis. This is from California and New York. And again, we're talking about the Delta wave, so we're looking specifically at hospitalizations. How severe was the disease in the various cohorts of people that were involved in the study? Now, just right off the top, obviously we're talking about California and New York, very large populations in both of those states. I think there's about 18-19% of people that are unvaccinated in both those states. So when you're comparing the numbers here, you're getting a very large sample size of people, which means that the integrity of this data is probably pretty high. So this is a good thing. So let's look at this particular figure here. So this is specific to California. And what we're seeing here is a breakdown of the risk of hospitalization based on the various cohorts of people. So you have unvaccinated people who have no previous COVID diagnosis, vaccinated people who have no previous COVID diagnosis, unvaccinated people with a previous COVID diagnosis, and vaccinated people with a previous COVID diagnosis. So those are the four cohorts. And when we look at this, you see that the unvaccinated people who have not had COVID were at the greatest amount of risk of hospitalization. And that is pretty well to be expected. We've pretty much seen this data throughout the course of the pandemic. I mean, it's been what we've been reporting on here for the most part is that when you're just taking a broad look at the population, those who are unvaccinated are going to have a bit of a tougher time with severe disease than those who have either had COVID or who are vaccinated. And again, we're going to put those numbers into more meaningful context shortly. And then we look at the vaccinated people who are the next most at risk here. These are vaccinated people with no previous COVID infection. So you can see that that's that dashed line that's blue there, up at the top above the other two lines below that. And you can see that their risk is only a little bit higher than those of the other two cohorts, which included the unvaccinated people with previous COVID infection and the vaccinated people with previous COVID infection. Both of those cohorts are basically equally at risk. So the key here is that those who are unvaccinated but who have had COVID are just as protected as those who are vaccinated with COVID or those who are vaccinated, in fact, with no previous infection. In fact, the unvaccinated people that had had COVID are actually more protected than the vaccinated people that hadn't had COVID. This, lends very, very powerfully to the concept of natural immunity. It also lends incredibly powerfully to the concept that you cannot treat all unvaccinated people the same way, because unvaccinated people that have had COVID are not part of the quote unquote problem that is being sort of beamed out in the mass media, which is the perspective that unvaccinated people are basically ruining this entire pandemic for everybody. It's just basically, that's not true at all. And the science does not support that. What this also tells us is that the science doesn't support the idea of a blanket one-size-fits-all mandate of everybody should be vaccinated. In fact, this suggests that people who have already had COVID probably should not be vaccinated unless they're maybe in a very vulnerable group and you feel as though it makes sense to say, well, we don't know how long this immunity is going to last from natural infection because we just don't have the data yet. It's impossible to tell for sure. Which, again, I would maybe only look at this if you're talking about vulnerable people. But for most people, it makes no sense to be vaccinated once you've had COVID. And for a lot of people in general, it may not make sense to be vaccinated at all, even if you have not had COVID, and that's what we're going to kind of break down next. Because if you were to take all this data and you were to just look at it, face value, you'd say, wow, unvaccinated people are at an extreme risk compared to everybody else of being hospitalized. I mean, look at this data. Look at this graph. Look how big the gap is between those two things. Well, the problem is when you take this and you put it into sort of the context of the actual risk of COVID, which I hope it's clear in some of the previous videos that we covered that the vast majority of people in the United States, for example, whether you're Republican or Democrat or independent, the vast majority of people are wrong about basic understanding of how severe COVID is for unvaccinated people or even for vaccinated people. In those particular videos, we see that, for example, over 50% of Democrats are completely out of touch with how the rate of unvaccinated people ending up in hospital. They're thinking it's anywhere between 30 and 50% chance that an unvaccinated person will end up in hospital from COVID, when in fact it's less than 1%. So that's important to understand that what's been going on has been misleading people in terms of political policy, in terms of the way politicians talk about things, the way the media talks about things. And so we have to understand, what is the actual hospitalization risk for specific people in different age groups when it comes to COVID. And, the CDC offers some data here from November 22nd, 2021. So again, particularly looking at data up until Delta. And you can see they don't offer a rate. So at what rate are 18 to 29-year-olds, for example, ending up in hospital? They don't offer that. But what they do say is that, in general, these people are, depending on where you go up on this list in terms of age or where you go down on this list, you can see that based on the reference group, these people have more of a chance as you go up. So, 30 to 39, 40 to 49, 2 times greater chance, 50 to 64, 4 times greater, and, so on and so forth. But you can see that, from 0 to 4, which is less than the reference group, and 85, there's about a 10 times difference there, a little more than 10 times. So you can see that, different age groups, just if we're looking at just the factor of age, different age groups are more at risk. So even to say, well, unvaccinated people that are 85 are very different from unvaccinated people that are 18 to 29 or even 30 to 39. And that's important to put into context, because when you start to go a little deeper and you look at it and you say, well, the rate of vaccinated people ending up in hospital in some calculations has been calculated to be about 0.01% chance of ending up in hospital from COVID. And in the unvaccinated people, it's 0.89%. You see that, both of those numbers are less than 1%. So the chances of ending up in hospital from COVID are very small. But on top of that, you do see that the vaccinated people are more protected, and the unvaccinated people are a little bit less protected. But when you again take this and put it into consideration and you say, well, hold on, I'm a 30-year-old, say, and I'm trying to make a decision about whether I need to be vaccinated. And, the TV is telling me that, unvaccinated people are just filling up all the hospitals. Well, I'm, let's say, a healthy 30-year-old, and I'm, I have no comorbidities. I'm 30 years old, and I don't know, maybe I've had COVID, maybe I've not, but the TV's telling me just go get vaccinated. Well, any medical intervention brings risk, right? And so we don't entirely understand all of the risks associated with COVID-19 vaccination yet, because one, it hasn't been around that long. The clinical trials were ended very early, so we don't see any long-term data. And we have this long discussion about safety signals coming out of reporting systems that are basically suggesting that the rate of injury for some people, and some studies even talk about this, the rate of serious injury for some people is significantly greater than for other people. Not only that, but young people who are not at risk of COVID might actually be at greater risk from the vaccine itself. So we need to be able to put all of these numbers into context for people to make reasonable decisions. And this is why it's important to understand this kind of stuff, because if you happen to be a unvaccinated individual, whether you have had COVID or not, in some cases it might be better for you to just not get a vaccine, because you can't just put all unvaccinated people into one category and say, well, they're unvaccinated, therefore their risk of hospitalization is really high. The data just does not support that idea. The data does not support the mandates, and I think it's just really important that there's a larger discussion around putting these numbers, putting these understandings into context. I would hope that this CDC study here pretty much shows, like the other 130 studies prior to this, that natural immunity is very robust, and that policy mandating vaccination does not make sense at all. You cannot say that this vaccine is necessary for all age groups, and the more we understand that, I think the more we can realize that what's going on? Why is government trying so hard to get every single person vaccinated? What is this concept around throwing the baby out with the bathwater and saying that all unvaccinated people are the same? It's just not true. The data does not support that. And if we buy into that idea, we're going to support bad ideas and potentially put people at risk that really don't need to be exposed to risk. That's it. That's all.